Ira Byock MD, Dying Well, Peace and Possibilities at the End of Life. In the book Dying Well, Peace and Possibilities at the End of Life by Ira Byock MD, the author examines the struggles and misconceptions surrounding end-of-life care in American society. Byock discusses how Americans generally avoid thinking about death, resulting in a fragmented approach to end-of-life care that can be detrimental to the dying and their families. The book emphasizes the importance of considering death as a natural part of life and highlights the potential for dying individuals to experience growth, serenity, and even bliss in their final days. Through various scenarios and expert advice, Byock illustrates the benefits of enlightened caregiving and its profound impact on how a person experiences the end of their life.
Rethinking end-of-life care. Americans tend to avoid thinking about death and lack a constructive vision of end-of-life issues or care. This leads to a confusing and ill-considered approach to end-of-life care despite the up-and-coming medical professionals receiving little training in dealing with the dying. Deficiencies in the U.S. healthcare system such as inadequate financing policies leave many people who take a long time to die becoming paupers, and insurance companies often ignore hospice options. As people struggle to make the right decisions in the midst of the staggering crisis of an imminent, untimely death, startling opportunities may be revealed for nurturing, honoring, and celebrating the person departing. If even the most emotionally robust among us will eventually die, a certain wellness in dying must be possible, which is why it's essential to rethink the current approach to end-of-life care. The art of dying. A person can die well, experiencing a sense of well-being while fully knowing they are leaving this life. The process of dying can be a profound and even blissful event, and an opportunity for growth and serenity. Dying is inevitable and can be a daunting process. However, it doesn't have to be excruciating and scary. In fact, when handled properly, the process of dying can be a profound and even blissful event, as precious as it is painful. This realization is what some enlightened caregivers understand. For the person, the process of dying cannot be understood merely as a medical event. Medical news reinforces the hope of a peaceful passing. Powerful medications can alleviate much of the pain associated with dying, and the dying feel less anguish as death approaches when someone is by their side. Death has illuminating possibilities if doctors keep dying patients relatively free of pain, allowing ill people to feel confident that their loved ones are there to support them. As in other developmental crises of life, such as adolescence, young adulthood, and midlife, a person can grow emotionally and spiritually, even as death nears. During the stage of life we term dying, many people can grow individually and together, offering precious opportunities to complete the most important of life's relationships. Dying people can experience positive, uplifting, and healthy emotions even as their bodies deteriorate. If the patient's medical care team approaches dying with wisdom and understanding, it can be a time of growth and serenity. Loved ones must commit to the final welfare of their dying relative or friend by maintaining the highest expectations that the experience of dying will be as free of pain and worry as possible. Physical suffering can always be alleviated. They need not die alone. Many times, the calm, caring presence of another can soothe a dying person's anguish. Many doctors and nurses know little about the particulars of end-of-life care, as most end-of-life care training takes up only a few hours of their medical education. Instead, medical schools emphasize curative medicine, which adds problems for dying people. To a significant degree, the provision of quality end-of-life care depends on the palliative care knowledge and expertise of the doctors, nurses, hospital, nursing home, or hospice program involved. The patient's professional team should align the care they provide with the wishes and goals of the patient and the family. Relatives must scrutinize their loved one's doctor's qualifications to ensure that they receive high-quality care during their final days. Finding superior institutions and trained medical professionals can be challenging. Many institutions don't pay enough attention to alleviating pain and preserving opportunities for dying people to live as fully as possible through the end of life. As a family member or a patient, your primary goal should be to ensure the best possible care. In America, there is a greater chance of dying in pain if you don't speak English and if you are Black, Hispanic, poor, elderly, or a woman. In conclusion, a person can die well, experiencing a sense of well-being, while fully knowing that they are leaving this life. The process of dying can be a profound and even blissful event, an opportunity for growth, and a time of serenity. By ensuring quality care in the presence of loved ones, the dying process can be made more comfortable and offer a chance for reflection, growth, and closure. Caring for your loved ones in the final days. This book's summary provides expert advice on how to handle difficult end-of-life scenarios, including how to talk about dying, how to ease physical and emotional pain, and how to choose nursing home care. Facing the end of life can seem overwhelming and scary, but it's a natural part of the cycle of life. It's important to have open and honest conversations with loved ones facing death. In this book summary, expert advice is offered on how to manage end-of-life scenarios that people commonly face. For example, when a loved one is dying of cancer, it can be hard to know how to talk about it. But it's crucial to start the conversation and discuss dying openly and honestly. The same is true for a loved one who is in a coma. Assume they can hear you and offer kind, simple gestures of love, such as playing music or giving a gentle massage. When a loved one needs nursing care, this can also be a difficult decision. But with proper research, it's possible to find the right nursing facility. It's important to look at all the options and get as much information as possible before making a decision. Physical pain in the final days can also be a challenge. The key is finding a doctor who is proactive in treating pain and is willing to ask questions to understand the type and severity of the pain. A palliative care team can be immensely helpful in providing pain relief and improving quality of life for the patient. Finally, when a loved one is contemplating ending their life, it's important to provide support and encourage openness. While it can be difficult to discuss suicide, it's essential to respect your loved one's autonomy. Most people with terminal illnesses can stop taking medication to hasten death, so it's important to have open and honest conversations about death and dying. In summary, this book provides valuable insight into how to navigate difficult end-of-life scenarios. It emphasizes the importance of open conversation, proper medical care, and being proactive in finding the right nursing home care. Ultimately, the key to caring for loved ones in their final days is compassion, understanding, and support. Embracing alternative approaches to advanced illness. Conventional medicine often prioritizes curative treatment options, regardless of their difficulty or cost, as the sole solution for the dying. However, this approach is not the sole option available. Palliative care and hospice programs provide viable alternatives that prioritize the quality of life for those with advanced illnesses. Medical professionals and individuals facing the end of life can benefit from exploring these alternative approaches. Assisted suicide and the value of life. Physician-assisted suicide has become a trend in the U.S. While aimed at advocating for dying patients, its legalization raises equity issues among certain groups who cannot fully participate in making decisions. The responsibility for end-of-life care must remain with the dying person and their families. The idea of dying well is often foreign to people due to their grounding in the factual and impersonal aspect of dying. Dying people who are in pain can embrace viable options beyond assisted suicide. Enlightened loved ones who learn how to care for a dying person can ease the experienced loss of meaning and the feelings of impending disintegration. Rethinking death. Death should be viewed as a natural part of life, and end-of-life care should be considered a basic human right. The provision of excellent end-of-life care requires specialized expertise from clinicians and palliative care specialists. The dying person needs shelter, assistance with personal hygiene, and loving companionship. Through providing excellent end-of-life care, the dying person can accomplish meaningful tasks and grow in ways that matter to them and their families. In some cases, death provides a special opportunity for reconciliation with friends and family members. Americans need to shift their perspective on death and view it as a natural culmination of a life well lived. The value of end-of-life care. In the final days of a person's life, the role of the caregiver is crucial in recognizing the person's identity and dignity. Celebrating the life of the dying person can be a significant and even sacred moment not just for the person but also for loved ones. End-of-life treatment that is compassionate and loving can elevate death to something worthy. Providing tender and loving care for someone in their final days is a beautiful gift that allows them to feel valued and dignified. In those moments, the caregiver is tasked with recognizing the individual's unique identity and acknowledging their core values. By celebrating the dying person's life, not only will they feel more at peace, but their loved ones also find meaning in these moments. End-of-life treatment that is enlightened and kind can transform death into something sacred, memorable and worthy. When a caregiver honors the dying person's dignity, it becomes a celebration of life that transcends death. Many loved ones have described this moment as a sacred experience. In conclusion, end-of-life care should be compassionate, respectful, and dignified, allowing the person to feel valued and loved. It is a chance to honor the person's life and celebrate their unique identity. By offering tender and compassionate end-of-life care, we can transcend death and elevate it to something beautiful and sacred.
In conclusion, Dying Well, Peace and Possibilities at the End of Life provides invaluable insights into the importance of redefining society's perception of death and the potential that end-of-life care holds for growth, emotional well-being, and reconciliation among family members. By acknowledging death as a natural and inevitable part of living, Byock encourages families and medical professionals alike to prioritize providing the best possible care for the dying, considering both their physical and emotional needs. The book underlines the existence of many available options to improve the dying process, such as specialized palliative treatments, better training for end-of-life care professionals, and even simple expressions of love and support. Ultimately, Byock implores readers to embrace the possibilities arising from enlightened caregiving, transforming the experience of dying into a peaceful and meaningful event for both the individual and their loved ones.